Welcome to my channel, The Psych Lens, where we explore the fascinating world of psychology. And today we will learn the meaning of psychology, its goals, and the different branches of psychology. So let us start with the basics. What exactly is psychology? Psychology is nothing but the scientific study of mind and behavior. It explores how people think, feel, and act in different situations. It examines biological, social, and environmental influences on human behavior. Simply put, psychology helps us understand why do we do what we do. But before modern psychology, people thought it was all about the soul. That is why the word psychology comes from the Greek words psyche, which means soul, and logo, which means study. Psychology has four main goals in understanding behavior. Let us look them one by one. The first goal is to describe. Psychologists first observe and describe human behavior. For example, why do people get nervous before an exam? And the second goal is to explain. Once we describe behavior, we try to explain why it happens. Is it due to stress, fear, or failure, or lack of preparation? And the third goal is prediction. By analyzing the behavior patterns, psychologists can predict future behavior. If someone frequently experiences test anxiety, they might face similar stress in job interviews. And the last goal is to change or control certain behavior. The psychology helps modify behavior for positive outcomes. Therapists, counselors, and even life coaches use psychology to help people overcome fears, improve productivity, and develop healthier habits. Let us understand this through the example. Just imagine a college student named Emma who experiences extreme anxiety before exam. Her heart races, she feels dizzy, and she sometimes even forgets what she studied. Let's see how psychology applies its four goals to understand and help Emma. The first step in psychology is to describe the behavior. This involves carefully observing and documenting what is happening. A psychologist would start by observing Emma's behavior before an exam. Observations might include she sweats and trembles before a test, her heart beats faster, she avoids studying because it reminds her of her past failures, she sometimes experiences nausea or dizziness. Why is this important? Describing the behavior helps in recognizing patterns. It also allows psychologists to differentiate normal test anxiety from an extreme case that might require intervention. Once the behavior is described, psychology seeks to explain the underlying causes. A psychologist would ask, why does Emma feel anxious before exam? And the possible explanation may include because of her past experiences. She failed an important test before and now fears failing again. And the next could include cognitive distortion. She believes that if she fails, she will disappoint her parents. Physiological response. Her body's stress hormones trigger a fight or flight response. And lastly, negative reinforcement. Avoiding studies reduces her anxiety temporarily but worsens the situation later. Why is this important? Again, understanding why a behavior occurs helps in creating solutions. Without explanation, treatment would be like giving medicine without knowing the disease. Once psychologists describe and explain a behavior, they can predict how it might appear in the future. Based on what we know, we can predict If Emma doesn't receive help, she will likely continue to experience severe anxiety before her exams. If she avoids studying, her grades will drop, reinforcing her fear of exams. If she learns relaxation techniques, she might handle stress better and perform well. Predictions allow for preventive actions. If we can foresee how behavior unfolds, we can intervene early to prevent negative outcomes and reinforce positive ones. The ultimate goal of psychology is to change or control behavior to improve lives. Now that we have described, explained, and predicted Emma's behavior, we can help her change it. The possible intervention we can suggest for Emma's are cognitive behavioral therapy, relaxation techniques, gradual exposure, making her take practice tests in a low stress environment, and study techniques, teaching her structured study methods to boost confidence. The ultimate goal is to empower individuals to make better choices, improve mental well being, and lead happier lives. How the four goals are connected. Psychologists observe Emma's anxiety symptoms. Second, they discover past failures and negative thinking as causes. And third, if left untreated, she will continue to struggle. Therefore, with therapy and study strategies, she can overcome her anxiety. This process applies to every psychological problem, from phobias to social behavior to workplace motivation. Now that we have understood the goals of psychology, let's explore its different branches. Psychology is a vast field with multiple specialization, each focusing on different aspects of human thought and human behavior. Abnormal psychology, or the study of psychological disorders, focuses on behaviors and mental health conditions that deviate from societal norms, such as anxiety, depression, schizophrenia, and phobias. Imagine Jake, who fears leaving his house due to extreme anxiety, called as agoraphobia. A psychologist specializing in abnormal psychology would diagnose his condition, understand its causes, and suggest treatment like cognitive behavioral therapy or medication. It is mainly used in clinical settings, hospitals, and rehabilitation centers. Behavioral psychologists study how behaviors are learned through conditioning and reinforcement. It suggests that behaviors can be shaped by rewarding and by punishments. A teacher wants students to complete homework on time. She starts giving small rewards, for example, like stars, or granting them extra playtime to those who submit on time. Over time, students learn to associate completing homework with positive reinforcement. This is an example of operant conditioning by B.F. Skinner. This can be used in parenting, in education, in habit formation, and in therapies for behavior modification. Clinical psychology deals with diagnosing and treating mental health issues like depression, post traumatic stress disorder, and bipolar disorder. Imagine Sarah, a war struggling with PTSD. A clinical psychologist would use therapy techniques like exposure therapy to help her process traumatic memories. Cognitive psychology focuses on mental processes like memory, problem solving, decision making, and perception. Imagine you forget where you placed your keys. Cognitive psychologists study memory patterns to understand why we forget things and how to improve memory using techniques like mnemonics or association methods. Developmental psychology studies how people grow emotionally, cognitively, and physically throughout life. A child psychologist might work with Tim, a 5-year-old struggling with speech delay, to develop intervention that support his learning and language skill. Educational psychology is a branch which focuses on learning processes and ways to enhance education. Imagine Lily, a student with ADHD who struggles to focus in class. An educational psychologist may suggest visual learning techniques or shorter study sessions to help her retain information better. Forensic psychologists apply psychological principles to criminal investigation, court cases, and law enforcement. A forensic psychologist is called to analyze the behavior of a suspect in a criminal case. They assess whether the person is mentally fit to stand trial or if they have a psychological disorder affecting their judgment. This is mainly used in criminal investigation, legal system, and police training. Health psychology focuses on how psychological factors influence physical health and illness. Lisa is diagnosed with diabetes but struggles to follow a healthy diet. A health psychologist would explore her emotional and behavioral barriers to adopting a healthier lifestyle and provide strategies for motivation. This is mainly used in hospitals, wellness programs, and in lifestyle coaching. Industrial psychology or organizational psychology studies workplace behavior, productivity, and employee satisfaction. A company notices high employee burnout. An organizational psychologist develops stress management programs and improves work life balance policies to increase productivity and job satisfaction. This is mainly used in corporate offices, HR departments, and business coaching. Social psychology studies how people's thoughts and behaviors are influenced by society and group interactions. Why do people follow trends on social media? Social psychologists study group influence, peer pressure, and advertising psychology to understand human behavior. Sports psychology focuses on the mental aspects of athletic performance. Michael, a professional soccer player, struggles with anxiety before big matches. A sports psychologist helps him use visualization techniques and breathing exercises to stay focused and confident. Experimental psychology conduct research to test psychological theories and improve understanding of human behavior. A scientist studies how people form memories by conducting an experiment where participants try to recall a list of words after distractions. And that's wrap ups our journey through the different branches of psychology, from understanding emotions to solving crimes and boosting sports performance. Psychology truly impacts every aspect of life. So, why should you care about psychology? Because it is everywhere, from helping individuals overcome mental health challenges to improve workplace productivity and even understanding social behaviors. Psychology is an essential part of our lives. If you found this video helpful, don't forget to like, share, and subscribe for more content on psychology and mental health.